Thanks, Sarah, and thanks for inviting me today to talk about Viva, our virtual visit approach. Next slide, please. So we have 3 projects that we've had funded so far, and our findings suggest that Viva could address loss of personalisation experienced, promote choice, positive risk-taking and empowering person-centred approaches. It could support complex discharges with frail older people and multi-morbid populations, present new resource efficiencies, promote integration across health and social care, and build research capacity in allied health professions. And now we can add to the list, support the COVID effort. Who knew that last year's novel innovation project would become this year's necessity for service delivery? Next slide, please. So research is a team sport, and this slide shows the team. We are a collaborative team across multiple organisations in Sheffield. Next slide, please. So we worked with OTs who talked about home assessments as providing an opportunity to visit the home environment and determine the care, equipment and adaptation needs by assessing the person, environment and occupations. And OTs said that sometimes they had difficulty with doing home visits and wondered if there was a technological solution. Next slide, please. So OTs know that home visits can be resource intensive, often taking 2 members of staff out, using taxis. It can take up to 4 hours from planning to completion of a visit, and visits are not always practical. Geographical boundaries and difficulties, risks involved, and sometimes it's just not possible to take the patient. So we proposed the use of technology to offer a solution. Instead of completing a home visit physically, it would be done virtually via technology. And we proposed that this could facilitate earlier discharge planning, potentially impacting on length of stay, and provide an opportunity for the patient to be involved in making informed decisions about changes to their home environment. Next slide, please. So this is a quote from one of our service users that was involved in the first project. He said that he felt out of control, wanted to be involved in the home visit but couldn't be, and he talked about having his dignity put in a box and unpacking it when he got home. Next slide, please. So the first project was a proof of concept project. The technology for Viva already existed. It was being used and deployed in Italy with emergency services during the floods, and it was brought over to Sheffield and adapted for the UK and for the NHS. And all you need is a smartphone or smart device in the home environment and a computer or device in the hospital. So project 1 was about testing the technology in 4 real-world scenarios. Next slide, please. So this slide illustrates how Viva works in action. A message is sent from a device at the hospital, and that's sent to a device in the home, and at the click of a finger, a video conferencing conversation starts up. The occupational therapist in the hospital can write a report in real time while the home visit is taking place, take pictures, videos, and can even turn on the torch of the smart device in the property. Next slide, please. So why do research? Well, Patricia Greenhalgh nicely sums this up. She says that implementing new technologies is a real challenge in health and social care. And while policymakers are calling for technology to be implemented rapidly and at scale, the reality is that we're dealing with multiple complexities in healthcare, and it's extremely difficult to go beyond the small scale demonstration projects. So research really helps us to understand the benefits of what works for who, in what circumstances and in what contexts. And we need to understand those challenges and barriers and look at how we deploy technology and what ingredients is required for sustainability. Next slide, please. So researchers found that planned and systematic stakeholder engagement can be a basis for creating awareness, gathering information about the technology and deployment, building consensus, and helping to make informed decisions about the development of the technology and bringing out the conflicts and the barriers. So in our second project, we undertook a significant amount of user engagement. Next slide. So the findings from our user engagement showed some anticipated benefits, an overall positive response for Viva. It's thought to engage the service user, create potential efficiencies, overcome geographical boundaries, and could potentially prevent readmission to hospital and also support learning for new qualified staff. Potential concerns and barriers included security concerns, the ability of the trusted assessor in the home environment, getting consent, the quality of the assessment, and OTs were worried about their loss of role and their loss of therapeutic relationships. So actually these stakeholder engagement sessions provided rich narratives and ideas for us on how to develop this technology and look at deployment. And the next project is going to focus on operationalizing the technology and looking at those barriers in a number of settings. Next slide, please. So project 3 was due to start in March. It's been slightly delayed because of COVID. But we are aiming to start very soon, and we've opened up the use of the technology to other allied health professions. So you can see there on the slide, we're going to be testing in a range of areas, and we're going to be using Viva for consultations, home visits, interventions, assessments, and family meetings over an 8-week period, followed by an evaluation for feasibility and acceptability. Next slide, please. So this slide shows you some of the outputs from the project so far. We've published some papers just recently, one in the British Journal of OT, and the information for that is on the slide. The next slide, there is a video which you can click on and watch at your leisure, and it shows Viva in action. And the following slide shows some of the evidence-based gaps around this area and some of the evidence that we've been using to support the development of our projects.